one area where I think more research and clarity than communication of that research is that moment when people go from pills to needles. And I don't mean to be so graphic, other than to say that I think that the drug companies would be interested in that research also. I mean, they may be willing to fund that because they're not making appropriate pain medications to be used during surgical procedures so that people will run down an alley in a street and buy illegal heroin. That is not their business model. So I think we should engage them to assist in getting good scientific data, good study data as to what is that connector that gets somebody from one step to the next. Because I think at those points, the reason it's secondarily vitally important is, as I said earlier, I think the problem is easier to solve when people are doing, in essence, what they view as legal conduct. When they cross over into illegal conduct, they are making a series of choices that are much more difficult to treat, and ones in which the public is going to be a lot less compliant in expending dollars for felons than they are for victims. And the sooner up that path we can figure out where that splitter line is, the better we can. So on research side, I do think that is an area that we get a public benefit from, that the drug companies would be interested in talking about, that the medical community is interested in talking about. And I think through that process, we could also learn some of the markers that cause folks to spiral out of control.
Solving that problem, as you say, is going to take therapy, right? It's going to take addiction treatment to get there. And as we know, I think we've heard time and time again that there's not enough beds for people to get this kind of treatment. There's not enough therapists out there to give them that treatment. People sometimes wait a long time. And we've seen in many cases that when people get proper treatment that they can overcome that addiction if it's ongoing. Can I ask you for your thoughts about getting enough treatment options available to people and being able to fund that, because we know it's very expensive?
Well, I like the idea that you talked about treatment options, because every human being is unique, and not every approach is going to be effective with every person. So we need a range of treatment. Some of that is medical, Suboxone and so on, but we also need the social and emotional support that's necessary to help folks who are caught up in these addictions to deal with that in a way that's going to have lasting consequences and lasting effect. And the fact is, we do, I said earlier, we've all said, this is a public health crisis. We need to embrace that. Once we do, then I think we can make the decisions that are necessary to see that adequate treatment becomes available. And we need to educate and train people that can provide this kind of treatment. Dr. Baker has taken it upon himself, right, to become trained in the proper use of Suboxone. And so we need more physicians that are willing to take those steps and to make sure that they're well equipped to deal with the medical conditions. But we also need the psychosocial supports that are necessary, and we need psychologists and social workers. And as Governor Lingle has said, take a community approach to this.
But all this, again, costs. So go ahead, please.
Yeah, no, if I could, I think that I agree 100% with what Ted has said, but I think also it's important to look at the other side of the coin, and that is the significant users, the illegal users, the folks that are out in the heroin trade and whatnot, folks that have made really bad choices and are continuing to do those choices. Somebody told me one time that among those folks, drug treatment has to be tougher than prison. If it's not, they'll take prison. And I think that while when you get to the very extreme end of this, I think that's why what Ted talked about as far as making sure that you don't treat every person the same. You're not catching these victims or these violators at the same moment in their life or the same moment of pain cycles. And so this is an area where you can make significant mistakes in the treatment if you don't have highly professional intake and highly focused follow-up. Because it's a lot different to deal with somebody who's had 7 convictions for heroin that you're busting for selling on the street than it is somebody that broke their arm and is taking too many pills because they took them from their sister or their cousin at recess because their arm was hurting at school. Those are much different folks.
To that, you're absolutely correct.
Mm-hmm.
Because the nephew that I have that is now clean, was faced with that choice once. He was faced with going into treatment or 10 months in jail, and he chose 10 months in jail. So it is true. These addictions are so powerful, people find it difficult to say, I want to give it up. I want treatment. I want to engage in the help that's available to me. Over time, thankfully, he reached the point where he was willing to accept treatment. But these are difficult, complex issues. And as I said, we're all very different.
Governor Legal?
Craig, may I go back to your question about research? I think we need a lot more research in several areas. Number one, why in America are these opioid pain relievers prescribed at twice the per capita rate of any other nation in the world? Canada is number two, but we're twice as much as Canada. Secondly, I'd like to know the amount of prescription drugs being given to children in this nation, what impact that is having on the result of this opioid epidemic. I've felt for a long time that children are being overprescribed significant drugs at a very young age. Third, I want to know what impact has television advertising of narcotic drugs having on our society. This used to be against the law to advertise these kind of drugs on television, and now you can't even turn on the television without seeing ads for these drugs. And then finally, again, we need an analysis of the Medicaid population. Why are they being prescribed drugs at such a high level? So I think there's a lot of missing research that we do need to help us to understand the front end. I think treatment is critical, and everyone has done a great job of addressing that. Law enforcement is an important piece. But if we could catch it before it begins, it's a lot easier, of course, and less expensive to individuals and to society.